There was actually a couple of years ago an update where we recognized that the Beighton isn't appropriate or wasn't appropriate for young children. So this paper came out in 2021 where they looked at the Beighton in children age 5. And here you can see that the Beighton score must be a minimum of 6. Normally it's 4 in adults.
Right.
In order to be relevant. And then you have to have all these, or some of the minimum of 3 skin and tissue abnormalities.
Yeah. You've got to have a degree in English to understand half of this as well, because there's some words in there that I've never seen in my life. Hemosideretic scars, which we're not going to get drawn down to at this point.
No, papyrosaceous scars is mostly seen in classic and vascular. They have really, really thin, almost papyrus-like scarring.
Yeah.
Wide scars, I mean, we're talking where most people get a scar that's maybe 1 millimeter or 2, they'll be centimeters. The bilateral pysogenic papules in the heel are little extrusions of fat through the fascia in the heels. I've got that on both feet. Hernias, very common, and they can be inguinal hernias, they can be stomach hernias, they can be hernias pretty much anywhere. And then you also have to have minimum 2 of the musculoskeletal complications where you have the pain and the joint dislocations or subluxations, not necessarily with trauma. It could be something as simple as a woman going to the gynecologist and having an examination, and then her hip joints will dislocate, which doesn't normally happen. Many doctors actually doubt that it can happen, but I've seen several women where it did happen.
Right.
So you have to have all these other issues too in children in order for them to be classified as Ehlers-Danlos.